Where can you find comprehensive medical services, expert clinicians, newly renovated spaces, and a breathtaking view all in one location? Only at the Des Moines University Clinic. Call today or visit dmu.edu/clinic.
Hello, my name is Karis Kassler, and I am here talking to you today on behalf of Des Moines University's Sigma Sigma Phi Honors Fraternity. Today, I would like to discuss with you the science of maintaining positive mental health goals in this talk on how to stay happy and healthy. The first thing I want to talk about is what mental illness looks like by discussing two common mental illnesses. Firstly, depression is a condition that most people think means that you're always sad, but the reality is that it encompasses so much more than that. Depression can mean that you are excessively tired, you're not sleeping well, or you're feeling irritable without really understanding why. Depression could also feel like confusion, trouble focusing, or no longer enjoying things that you used to enjoy. That could include playing games, going on walks, being with friends and family, watching your favorite TV show or listening to music, or even everyday activities like cooking. Sometimes depression can cause you to eat less or eat more than you usually would. You may cry a lot more than you used to. Depression can also mean having thoughts of ending your life, whether that's having a definite plan or feeling like it would be okay if you weren't around. Depression can also cause physical symptoms like headaches, muscle aches, and digestive troubles. Secondly, anxiety is defined as excessive nervousness, fear, or worrying. Everyone worries sometimes, but if your worrying is causing you to fear leaving your house, being around your support system, or constantly thinking about traumatic events, it becomes anxiety. Anxiety, like depression, can also have physical symptoms like chest pains, headaches, sweating, and digestive distress. So now that we know what mental illness looks like, what causes it? The simple answer is that we don't have a simple answer for that. Conditions like depression and anxiety are multifactorial, meaning that oftentimes there's more than one cause. For depression, if you have a family history or a personal history of depression, you're at an increased risk for developing depression as an older adult. If you experience a stressful event in your life, like the loss of a loved one, a difficult relationship, or physical isolation associated with COVID-19, these events can increase your risk for depression. Additionally, some people just have different levels of hormones in the brain, meaning that depression originates at the chemical level. With anxiety, if you concurrently have a physical illness like COPD, cardiovascular disease, thyroid disease, or diabetes, just to name a few, this can lead to excessive worrying over physical health symptoms that can increase your risk for developing anxiety. Additionally, medications that are used to treat these conditions can have anxiety as a side effect. If you're not sleeping properly or have physical limitations to your daily activities, this can also increase your risk for anxiety. Similarly to depression, stressful or negative events from childhood or adulthood, like living during a pandemic, can contribute to the risk of developing anxiety disorders. All of that being said, the most important thing to take away from this talk is that if you are experiencing any of those feelings or symptoms, you are not alone in what you're feeling. You are not weak because of what you're feeling, and there are ways to work through what you are experiencing. Because of the societal stigma surrounding mental health, anxiety and depression are underdiagnosed and undertreated. This phenomenon is seen in all age groups, but it's particularly pronounced in people over the age of 55. Depression is found in 1 to 5% of the population over 55, and anxiety is seen in 3 to 14% of the population over the age of 55. Depression and anxiety are not normal parts of aging, but they are not uncommon in aging adults. So if you take away one thing from this talk today, I hope it's that you hear that you are not alone. The good news is that there are things that you can do to actively improve your anxiety and depression symptoms, if these are things that you're experiencing. The first thing that will have a positive impact on mental health is social involvement. Seniors on the Move is a program that has monthly or yearly subscriptions available for you to have access to lifestyle planning, weekly events, community outreach, lifeline screening, and medical coverage for vision and dental. Visiting Angels is a personal home care service that can provide companionship and daily activity assistance without a prescription for home health care. Both of these programs are ways to facilitate social interaction, especially in times when that can be difficult to come by. Next, nutrition has an incredible impact on our mental health, so it's important to make sure that you are maintaining a well-balanced diet. You should definitely consult your physician about a dietary plan that is best for you, but focusing on eating fruits and veggies, lean proteins like fish or chicken, whole grains, and low-fat dairy are the staples of a well-balanced diet. Shopping can be really challenging during these COVID-19 times, but there are options available specifically for vulnerable populations. Hy-Vee, Walmart, and Target have pickup and delivery options for groceries where they load groceries into your car for you to make it safer. Instacart is another really great service available where you can have food delivered directly to your door from Aldi, CVS, Sam's Club, and Costco. You can also have groceries delivered from Whole Foods by using Amazon. If you would rather still do your own shopping, there are also options specifically for vulnerable populations, like at Price Chopper, Walmart, and Target at the hours that are listed here on the slide. These options all make it possible to stay safe, but make sure that you are eating a well-balanced diet that can positively impact your mental health. It's also important to note that medical professionals are here to help you with mental health concerns. Whether you feel more comfortable talking in person or through a virtual appointment, there are options available to you within the medical community. Talking with physicians about how you have been feeling and seeing if maybe starting a medication to help with your mental health could be very beneficial. Your physician may also consider other physical concerns that could be negatively affecting your mental health, like chronic fatigue, chronic pain, or gastrointestinal concerns, and they could talk to you about options available to improve those physical concerns. Talking to a therapist is also an option available to you that can help you to express your feelings in a controlled setting where you can learn to know that your feelings are being heard and that your feelings are valid. Emotional expression is always important, but especially so when we're talking about maintaining positive mental health. Talking about what you are experiencing is helpful for you, but it is also helpful for those around you who love you and care for you and want to understand what you've been struggling with. In order to feel healthy emotions, it's important to learn to express feelings, whether they be positive or negative, because all feelings are valid. Talking to friends and family, talking to a counselor, joining a support group for people in similar situations, participating in artistic activities like painting or drawing, and writing down your thoughts are all healthy ways to express your emotions that will positively contribute to your mental well-being. On top of all of those things, there are activities that you can do every day to help maintain a positive mental outlook during your situation. Staying connected with those that you love is more important than ever right now. You can do this through family game nights or dinner nights that are either socially distanced or through video calls. Writing letters to loved ones or journaling are helpful ways to organize your thoughts into words. Spending at least 15 to 20 minutes outside every day, either gardening, walking, or just sitting and enjoying fresh air, can go a long way towards feeling better. There are many outdoor socially distanced activities at Center Grove Orchard, Berry Patch Farm, Geisler Farms, Iowa Orchard, and Howell's Pumpkin Patch that can safely allow you to have fun outdoor experiences. Making sure you're getting 7 to 9 hours of restful sleep a night will also have a very positive impact on mental health. If you are able, adopting a pet to act as a companion is shown to improve moods and motivation in day-to-day life. Also, don't forget to exercise your mind. Doing crosswords, Sudoku, or jigsaw puzzles can be a great way to keep your mind active, and an active mind can improve mood. This is by no means an exhaustive list, but it is a list to get you started if you're looking for ways to improve your mental health in your day-to-day life. All that being said, why did we choose to talk about this topic today? We chose this topic because of the situation that the world is in, with this global pandemic forcing physical and social isolation on us all. Mental health issues have been arising in every population as a direct result of the state of our world. There is a societal stigma around talking about mental health and admitting that you are struggling with these feelings, so no one talks about it. We think that needs to change. We want you to know that it's okay if you are experiencing these things, or if you know someone who is struggling with these feelings, to give you tools to help them through it. There are steps that you can actively take to improving your mental health. It's really easy right now to get caught up in all of the negativity in the world, but if you can find one positive thing in every day, because there is always at least one positive in every day, you will find that you have a new appreciation for life. That's not always easy to do, and sometimes you need people to help you do that. But know that you are not alone, and there are resources to help you along your way. These 3 organizations are excellent resources for anyone who is struggling with their mental health. The National Alliance for Mental Illness is available for social engagements that talk about the importance of being open and destigmatizing mental health discussions. The National Suicide Prevention Lifeline and the Disaster Distress Helpline are available 24/7 to talk if you feel like you need someone to help you through what you are feeling. The most important thing to remember is that you are not alone. Thank you for attending this topic in your virtual senior health fair, and I hope you have a wonderful rest of your day.
At the Des Moines University Clinic Osteopathic Manual Medicine Department, our physicians treat a full range of health conditions according to our different specialties. We integrate osteopathic manipulative medicine into a wide range of backgrounds and trainings, including family medicine, internal medicine, pediatrics, rehabilitation medicine, and neuromusculoskeletal medicine. Osteopathic manual medicine, or OMM, is a hands-on, non-invasive way to assess and treat the structure of the body to improve the function of all systems in the body. DMU's osteopathic physicians assess the structure of the body for twists and turns in the body's framework that can either contribute to or altogether cause your original disease or illness, even injury. These twists and turns are diagnosed and treated by the physician's own hands. Some examples of conditions we treat include adults with chronic illnesses in breathing, digestion, sinus infections, needing help healing after surgery, nerve damage, diseases of the spine, and migraine headaches. We even treat pregnant patients and babies. OMM allows the body to function more efficiently, supporting the ability to fight off disease and more easily recover from illness, injury, or surgery. DMU's clinicians provide thorough consultations to patients to address illness and symptoms that may not be helped by conventional treatment. We invite you to give our clinic a call if you're looking for a physician who can help you get to the root cause of your illness or injury. We're here to help.